For the procerus injection point, take a line from one medial canthus to the opposite head of brow and repeat on the other side. Where these two diagonal lines intersect will be our first injection point. For the head of corrugator, take a line coming up from the medial canthus and palpate the muscle just above the orbital rim. And in line with the medial canthus, we can place a second dot. We can then repeat this on the other side. These are our first three injection markings. Next, we need to mark out the points for the tail of the corrugator. When I ask Hannah to frown, I will then palpate the orbital rim and go a centimetre above the rim, just medial to the mid-pupillary line. You will notice that these dots form a V shape. I now want to mark out the injection points for the frontalis. When I get her to elevate the brows, I can see the extent of the lines, and I will then proceed to make the injection marks across the forehead. I keep the marks in the center of the forehead slightly lower, but I keep the lateral marks higher because I want to give her the maximum brow elevation. Finally, I palpate the lateral temporal fusion lines, and in this region, the orbicularis oculi muscle fibers go from horizontal to vertical, and the action is to pull the tail of the brow down. Accordingly, if we inject with botulinum toxin in this region, we can get a subtle elevation of the tail of the brow. Let's begin by injecting the procerus. You will notice I pinch the skin with my finger and thumb. I insert my needle the full length because this is a deep injection, and then I will gently inject the first 4 units into the procerus muscle. Next, I move on to the head of the corrugator on her left side. I use a finger in the orbital rim to prevent diffusion. I will pinch up and squeeze the muscle, and again, this is a deep injection with the full length of the needle down, and I'll inject another 4 units. I will now move on to her right head of corrugator. This time I will use a thumb in the orbital rim, and again, deep placement of the full length of the needle down onto the head of corrugator, and another 4 units. When I inject the tail of the corrugator, I have to use a different approach. Because I want to be as superficial as possible, I will come in from the side and I will angle my needle so I am just intradermal, and I will just put the beginning of the needle in and I will inject 2 units in. Ideally, I want to raise an intradermal bleb. I repeat this on the other side with another 2 units injected superficially. When I inject the frontalis, my preferred depth of injection is intradermal. Some injectors go deeper, almost onto the bone. However, I think that the patients find this more painful. Accordingly, I keep my needle and syringe relatively flat, and then I will inject just with the tip of the needle into the dermis of the skin, knowing that the toxin here will diffuse into the muscle. The dose that I'm using for Jenna here is 1.5 units in each of the injection sites. This might be a slight undertreatment, but I can always add a little bit more at review. If we inject too much product here, it could lead to a brow ptosis. Finally, we inject the orbicularis at the tail of the brow for our brow lift. The most important thing here is the depth. We need to be as superficial as possible because the very thin muscle is just below the skin. Accordingly, I just introduce the tip of my needle and inject 2 units at the tail of the brow.